Well, good morning, everyone. My name is Cliff Knight, and along with Neil Busis, we are the co-leads for the Messaging and Communications Working Group, and I don't think it's an exaggeration to say we're thrilled to be in that role and to support this team. And you see the names there of the folks that are on this team, and it really is an incredible group. And what the names you don't see up there are the names of the NAM staff that you've already heard about this morning, but they're really the ones that drive the actual deliverables that you've seen from the action, from the collaboration. With our working group, we've really been focusing in the last year on three specific areas: developing and distributing and testing messages to frame the issue of clinician burnout, disseminating scientific information about the breadth, impact, and drivers of burnout, and then facilitating collaboration and sharing of resources among influencers. And so there's really three things that have come out of this working group over the last year. We've collected and published over 150 organizational commitment statements. We've completed high-level message testing, and then developed and curated a comprehensive resource repository, which is the Clinician Wellbeing Knowledge Hub. And Neil's going to take you on a guided tour of the Knowledge Hub in just a minute. And so, but first, a little bit about the organizational commitment statements. Hopefully each of your organizations have participated in this. We've collected over 150 different commitment statements from organizations, and these are available for you to go online and review each of those commitment statements. And if your organization hasn't yet developed a commitment statement and submitted it, that call for statements remains open, and so please do that. And I think when you read through some of the commitment statements, you'll understand how important it is for us to all be sharing our perspectives on the work that we're doing. Next then is the message testing, and in fall of 2017, over 800 people were surveyed around the messages that we were developing, and the majority of the folks surveyed are either practicing clinicians or clinicians in training, but we heard some very loud and clear results from that survey. First, it's really emphasized people over profits. You know, one of the things that we really hear is this shift in the healthcare culture from relationships, from the human side of things, to more of a corporate speak and to more of a transactional environment. And so trying to really emphasize the people over profits aspects of this. Focusing on fixing the system, not blaming the clinicians. That this really is a system issue, and that we've got to focus on supporting the clinicians while we're fixing the system. Keeping messages brief, that's all I'll say about that one. And then using statistics and specifics in our messages, and using images that really convey the seriousness of burnout, and then helping to frame the issue positively from the standpoint of looking for solutions that really drive to what we aspire to, and that is clinician well-being and a true sense of satisfaction in the work that they're doing on a daily basis. And then we've launched the Knowledge Hub. This launched on March 22nd, and it really was developed to bring all of the current research and resources into one location. The whole idea here is to make it easier, simpler, that if you want to find something on burnout, to understand it better or to look for solutions, that you should be able to come to one source to be able to find that. Similar to the work of the overall Action Collaborative, the Hub encompasses clinicians from across all specialties: pharmacy, nursing, dentistry, and many others, and at all stages in their career paths. And the intent is that the Knowledge Hub will enable health system leaders and clinicians to thoughtfully and strategically execute solutions that promote clinician well-being. And then, you know, rather than spending a lot of time having to look for these things, having one place that you can go to find them. And we believe that this will drive meaningful change by helping users to understand burnout, its causes and effects, and tangible solutions, and most importantly, to be able to influence those that are making decisions that impact the environment that our clinicians are in. So I am curious, who all in here have accessed the Knowledge Hub in the 6 weeks it's been live? Awesome. That is great. Well, I'm going to turn over to Neil, and he's going to take you through a guided tour now.
Okay, so if we could switch to the web browser. So this is a live view of the homepage of the Knowledge Hub, and as Cliff stated, we intend for the Knowledge Hub to be a one-stop shop for those wanting to learn more about clinician burnout and those looking for solutions to improve clinician well-being. And I want to emphasize one thing up front. This is not a reproduction of PubMed. So while we have peer-reviewed literature on it, we also have art, we have websites, we have quality improvement projects. We have a lot of other things which will be coming, so that this will be much broader than what you would get from a usual Google Scholar or PubMed search. If you look at the Knowledge Hub, scroll down, actually scroll up a little teeny bit. You will see the 5 main sections in the upper right corner. About, causes, effects, solutions, and the Resource Center. Then there's a search box to look for resources. Then scroll down a little bit. There are 3 featured resources we think are most useful. Scroll down a little bit further. Then there's cause, effects, solutions, which is a secondary navigation hub. Those boxes talk about meetings, collaborative activities, etc. Scroll down a little bit more. Then there's some rotating graphics. You can see the little arrows. You can go left and right. They rotate regularly, or you can scroll through them on your own. You can share those on social media. Scroll a little bit further. And then there's a disclaimer that if you are feeling distress, you should call 911 or the National Suicide Prevention Lifeline if you feel suicidal or need emergency help. And then here's our sitemap. And this was developed with user feedback. So these are terms that users resonate with for the different topics and subtopics of burnout. So let's move on to the About page. And this is basically designed to orient users to the site and provide information of the Action Collaborative. Scroll down to the current version of the knowledge, the conceptual model there. This is a static graphic. This will be replaced soon with an interactive, in effect, web application that will be an alternative way to go through the Knowledge Hub. Now, if you could go to the effects page. So this is an example of one of the pages about effects, and you'll see there's subtopics. So it's like a little textbook of burnout and well-being. And then if you could go back up to solutions. By the way, solutions, not surprising, is one of the most common places that people go first. And then go to organizational strategies. So this is an example of a subtopic page. And each subtopic page provides a summary of the topic with links to helpful resources and research. That's under that graphic. And then there are a few other ones that have been voted up as useful by people. And let's move on to the Resource Center then. The Resource Center has a bunch of resources, over 470 now. You can filter them by various things on the side, including keywords, relevance, popularity, helpfulness, topic area, other tags, etc. The idea is to make it easy for you to find resources. Click on one of the resources at the top there, and click that, move down a little bit, and you can see that you can vote whether or not the resource is helpful or not. And those resources that are most helpful to people will rise to the top of search results and on the subtopic pages. And then go back to the About page and scroll down. Your opinion matters to us, and we are going to develop this in an iterative process. So click that. There's a feedback form that you can submit, and that will enable us to help you meet your needs in this research hub serving you, in this knowledge hub serving you. Then let's switch back to the last slide in our section. We also have, should be slide 17 in the PowerPoint. We have an online toolkit that you can access via nam.edu/toolkit, and this is a way for you to share Knowledge Hub information resources with your colleagues. Everything there is free to download, and you can use them on your website, newsletters, conferences, meetings, and on social media. So that's a quick overview of what we've done, and I'll hand it off to Sunny.